6 Most Strange Babies Who Were Born Differently. Number 1. Runa Begum. Runa Begum was a girl from Tripura, India, who was born with a rare condition called hydrocephalus, which caused her head to swell up to a very large size. Due to the pressure on her brain and skull, Runa had difficulty breathing, moving, and seeing. She was then taken to a private hospital in Delhi, where she underwent several surgeries to reduce the size of her head and drain the excess fluid. Although Runa showed some signs of improvement after the surgeries, sadly, she passed away in 2017 at the age of 5, just before her final surgery. Number 2. Christopher Alvarez. Christopher Alvarez is a 24-year-old man from New York, USA, who was born with a rare genetic disorder called thanatophoric dysplasia. This disorder is characterized by severe skeletal abnormalities, including extremely short limbs and folds of extra skin on the arms and legs. Surprisingly, Christopher Alvarez is one of the few survivors of thanatophoric dysplasia. He is dependent on a wheelchair for mobility and a ventilator for breathing. Despite these challenges, Christopher is a positive and inspiring person who has a deep love for music, art, and video games. Number 3. Rama Haruna. Rama Haruna was a Nigerian teenager who was born with a rare condition called phocomelia, which affected the development of her limbs. She had no legs and only one partially formed arm. She spent most of her life in a plastic bucket, which her family used to carry her around. She became famous when a photo of her and her brother went viral on social media. She died on December 25, 2016, at the age of 19. Number 4. Rajeshwari. Rajeshwari is a 7-year-old girl from a tribal area in the Dantewada district of North India who suffers from a rare genetic disorder called acthosis. This disorder causes her skin to become hard, scaly, and blistered. The disease makes her daily life very painful and difficult, as even simple activities such as walking and sitting can cause blisters and wounds. She requires regular medication and wound care to control the disease and prevent infections. Unfortunately, her family cannot afford the necessary treatment. Number 5. Lakshmi Tatma. Lakshmi Tatma is a girl from Bihar, India, who was born with a rare condition called ischiopagus. This means that she had a parasitic twin attached to her body, giving her the appearance of having 4 arms and 4 legs. When she was 2 years old, she underwent complex surgery to remove the extra limbs and organs of her twin. The surgery lasted 27 hours and involved more than 30 surgeons, but it was successful and saved her life. Lakshmi is now 9 years old and lives with her parents and siblings in a village. Number 6. Grace Novacek. Grace Novacek is a 16-year-old girl from Westlake, Texas, who has a rare genetic disorder called Escobar syndrome. This condition affects the development of the joints, muscles, and skin. Grace was diagnosed with Escobar syndrome when she was 16 months old after her parents noticed that she had difficulty moving her neck and limbs. Since then, she has undergone 33 surgeries to improve her mobility and appearance. Despite her difficulties, Grace is a positive and inspiring person who loves learning, traveling, and helping others. She is a talented pianist who has been playing since she was 6 years old. Grace hopes to become a doctor or a researcher someday and find a cure for Escobar syndrome.